Hi, so today we're going to be doing a medication pass. The first thing you want to do is you're going to look at your MAR and you're going to compare it to your doctor's orders. You are going to make sure that you have the right patient. In this scenario, we have Lulu Bacilla. We are also going to check for any allergies, and Mrs. Bacilla is allergic to codeine. So after we have verified those things, we are going to go into our med room and we are going to retrieve our medications from our Pyxis or whatever system we are using. This morning we are going to be giving the 9 o'clock meds. So the first medication on the MAR is Colace. You are going to pull your Colace out. Going to make sure that it is the right medication. You are going to make sure that it is the right dose. We are to give 50 milligrams PO daily. This is 50 milligrams. We are also going to check the expiration date, and this says 06/18/2021. So this medication is okay. Next, we are to give lisinopril. We are to give 10 milligrams PO daily. So you're going to pull out your lisinopril. Again, making sure that it's the right medication. The right dose, we are to give 10 milligrams. This says 10 milligrams. And again, you're going to check the expiration date, which is 10/20/2022. So that is okay. Next, we are to give Lasix. We are to give 40 milligrams PO daily. Have our Lasix, 40 milligrams, which is how much we have to give, and the expiration date is 2/12/2021, so that is okay. We are also going to be giving magnesium hydroxide, which is also known as milk of magnesia. We are to give 30 milliliters, and this is a one-time dose that is to be given in the morning. So we're going to pull our medication, make sure it's the right medication. We're going to be giving 30 milliliters. This is definitely more than 30 milliliters. So we are going to be pouring this up in the patient's room. And we're also going to check the expiration date, and this is 05/10/2023, so that is okay. When passing medications, there's also certain things you need to assess. For instance, with the milk of magnesia, that is given for like upset stomach and in some cases constipation. So you would assess bowel sounds and also ask the patient about their bowel habits and any nausea or vomiting they may be having. With Colace, that is also given for constipation, so you would assess again bowel sounds and ask the patient about their elimination, and again ask if they have any nausea or vomiting or anything like that. Lisinopril, that is a blood pressure medication, so you would check the patient's blood pressure. You would also check the patient's pulse. For blood pressure medications, you would just check to make sure that the blood pressure is within range. So for instance, if the blood pressure was less than 130 over 80, you would not be giving a medication such as lisinopril. And you would also check the heart rate to make sure that it is within range to be able to give the medication. Lasix is given in some cases to patients with heart failure. So you would assess the apical pulse. You would also monitor blood pressure, and Lasix draws upon potassium. So if we look at our MAR, it says to call the doctor if the potassium level is less than 3.5. So you would make sure that your potassium is at least 3.5 or greater to be giving the Lasix. And that is it as far as assessments go. Next, we are going to do our second medication check. So, again, we have Colace. We are to be giving 50 milligrams. The expiration date is 06/18/2021. Next, we have lisinopril. We are to give 10 milligrams. The expiration date is 10/20/2022. Next, we have our Lasix. We are to give 40 milligrams, and the expiration date is 2/12/2021. Lastly, we have our milk of magnesia. We are to give 30 milliliters, which we will pour up in the patient's room. The expiration date is 05/10/2023. So that is our second medication check. So while you are doing your first and second medication check, you want to make sure that you keep your medications and the packaging, and you will open them once you get to the patient's room. So now that we have all the proper assessments done, we did our first and second medication check, we are going to go ahead and head to our patient's room. So prior to going in, you are going to perform hand hygiene. You would also knock before entering, and you would enter the room, and you would begin your introduction. For instance, I would say, "Good morning, my name is Angie, I'll be the nurse taking care of you today. I have your 9 o'clock medications for you." You would ask the patient for their name and their date of birth. While asking them, you would also be looking at their wristband to make sure that the information is correct. After they verify their name and date of birth, you would ask if they have any allergies. She's going to tell you that she is allergic to codeine. So you're going to let her know, yes, okay, I see this is in your MAR and in your chart. So next we are going to begin our third medication medication check, and we are going to prepare our medications. So we are going to give Colace, which is for constipation. We are to give 50 milligrams. The expiration date is 06/18/2021. We checked everything. We are going to open our package. we are going to get our cup ready, and without touching it, we are going to put the medication in the cup. Moving on to the next medication, we have lisinopril, which is for high blood pressure. We have 10 milligrams. The expiration date is 10/20/2022. Going to open that up. Going to put it in our cup. We have next the Lasix, which is for heart failure. We are to give 40 milligrams. The expiration date is 2/12/2021. Again, we're going to open that up, have our cup, we're going to put it in our cup. And lastly, we have milk of magnesia, and we are to give 30 milliliters. The expiration date is 05/10/2023. So with this medication, it is a liquid, and it is also a suspension. So we're going to palm the label, shake our medication, make sure that everything is distributed evenly. We're going to have a measuring cup. We're going to open our medication, and we're going to measure out and pour 30 milliliters, making sure that our palm is to the label. Also, when pouring this medication, you want to make sure that your cup is at eye level when measuring out the medication. So that is our third medication check. Now we are going to administer our medications to the patient. We are going to give the pills, make sure that the patient has an adequate amount of water, make sure that Miss Priscilla gets the pills down okay. Then we are going to give the milk of magnesia as well. After the patient is done taking the medications, you want to make sure that you let the patient know that you will be back in 1 hour to reassess the patient to make sure that everything's okay. And then you want to make sure that the patient is comfortable, that they have their call light and their belongings with them. Then before leaving the room, perform hand hygiene, and then you also want to make sure that you document the medications that you gave. When passing meds, there are 6 rights. Those 6 rights are the right patient, the right medication, the right dose, the right time, the right route, and then the right documentation. So I think that is all I have. Thank you.